Hello, my name is Becky Kelsch, and I'm going to present part 2 of the Future of Health IT. As Carrie explained in part 1, the ONC has developed a strategic federal health IT plan for 2020 through 2025. This new plan has 4 goals to try to address the challenges and opportunities that are facing healthcare today. These 4 goals are 1. To promote health and wellness, 2. To enhance the delivery and experience of care, 3. To build a secure, data-driven ecosystem to accelerate research and innovation, and 4. To connect healthcare and health data through an interoperable health IT infrastructure. So let's break these goals down into their objectives and explain the strategies behind each objective. We will begin with the goal of promoting health and wellness. The first objective is to improve the individual access to health information. The ONC has come up with 4 strategies to meet this objective. They are to enable individuals to access their health information via mobile apps and patient portals, to promote greater portability of health information through interoperable health IT that allows the patient to send and receive their data, to improve access to smartphones and other technologies for individuals who may not currently have access, and to build the evidence base on the use of health information. The second objective of promoting health and wellness is to advance health and safe practices through health IT. The 3 strategies to meet this objective are to promote health behaviors and self-management through patient-facing apps and wearable technology, to leverage all levels of data from individual level to community level, and to advance the use of evidence-based digital therapeutics as treatment options using smartphones, tablets, and other personal devices. The final objective is to integrate health and human services information. The ONC has come up with 3 strategies for this objective. They are to strengthen communities' health IT infrastructure by introducing a secure exchange of data across healthcare and human services settings, to foster greater understanding of how to use health IT to address unmet health and social needs, and to capture and integrate social determinants of health data into EHRs to assist care processes and address health disparities. The second goal in the Strategic Health IT Plan is to enhance delivery and experience of care. The first objective under this goal is to ensure safe and high-quality care through the use of health IT. To meet this objective, the ONC has developed the following strategies. Optimize care delivery by applying advanced capabilities like machine learning, evidence-based clinical decision support, and smart dashboards and alerts. Expand care beyond traditional clinical settings through remote monitoring or telehealth services. We've heard a lot about telehealth services with the recent coronavirus. Continue efforts to establish identity solutions that improve patient matching across data systems. Support expanded use of health IT for promoting safer clinical practices to prevent adverse events. Use electronic clinical quality measure data to improve providers' and researchers' abilities to assess quality and outcomes. Implement mechanisms of data governance to promote safety, security, and accountability, to promote interoperability and data sharing through widely accepted standards, and finally, to customize care through precision medicine to assist in the diagnosis and treatment in real time. The next objective for goal number 2 is to foster competition, transparency, and affordability in healthcare. The 4 strategies to meet this objective are to encourage pro-competitive business practices, to support efforts to merge administrative and clinical data streams to have real-time financial data, to make care quality and price information available to individuals, and to educate consumers on the availability, quality, and price information. The next objective, to reduce regulatory and administrative burden on providers, will be met by 5 strategies. These strategies are to promote the use of evidence-based automated tools to streamline provider workflows, to monitor the impact of health IT on provider workflows to optimize the use of technology, to promote greater understanding of applicable regulations and practices so compliance is achieved, and finally, to harmonize provider data collection and reporting requirements. The final objective of enhancing delivery and experience of care is to enable efficient management of resources and a workforce confidently using health IT. The strategies to meet this objective are to streamline processes, to implement education and training programs, and to continue to invest in the federal health IT workforce. Okay, now we'll move on to goal number 3. Goal 3 is to build a secure, data-driven ecosystem to accelerate research and innovation. The first objective for goal 3 is to advance individual and population level of transfer in health data. This objective has 5 strategies. They are to improve harmonization of data elements and creating standards by creating a common vocabulary, to bolster secure access to large data sets of health information for use in quality improvement and outcomes research, to support appropriate use of health and human services data in the state and federal level systems, to enable individuals to securely provide data via apps and other health IT for research, and to foster data governance that supports a secure and uniform platform to support innovative uses of shared data. The second objective is to support research and analysis using health IT and data at the individual and population levels. This objective will be met with 4 strategies. These are to increase the use of new technologies and analytic approaches for improving quality outcomes and decision making, to build the evidence base on use of health IT for improving quality through research, to increase research into targeted therapies using real-time data and machine learning intelligence, and to identify and implement health IT opportunities that support rapid sharing of disease surveillance data. Next is goal 4. We're almost done. Goal 4 is to connect healthcare and health data through an interoperable health IT. Let's take a look at the objectives. The first objective is to advance the development and use of health IT capabilities. To meet this objective, the ONC has developed 8 strategies. These strategies are to promote a digital economy that can lead to the development of new business models in healthcare, to reduce financial and regulatory barriers that prevent health IT developers from entering the health IT marketplace, to promote trustworthiness of health IT, to develop frameworks to assess patient and care team use of new technologies, to support provider adoption and use of health IT, to enable competition by reducing switching costs between EHR and other health IT products, adopt and advance nationally endorsed standards, implement specifications and certification criteria, and finally, to follow health IT safety and user-centered design principles in the development and design. The next objective is to establish transparent expectations for data sharing. The strategies to meet this objective are to address information blocking, develop resources and communication plans on how to comply with regulations, support a common agreement for nationwide exchange of health information that drives interoperability, supports strategies, and promotes governance, and to promote data liquidity to eliminate unnecessarily restrictive data sharing practices. The third objective for Goal 4 is to enhance technology and communications infrastructure. The 4 strategies for this objective are to assess current and expected broadband needs and gaps in the healthcare sectors, to improve and expand affordable broadband access and wireless infrastructure, especially in rural and underserved areas, to deploy cloud-based services that comply with federal standards, and to promote adoption of infrastructure needed for telehealth. The final objective is to promote secure health information that protects patient privacy. Patient privacy is the core of our profession, right? The strategies to meet this final objective are to integrate privacy and security considerations into the design and use of health IT to protect data from cybersecurity attacks and fraud, to implement privacy and security mechanisms as appropriate to the sensitivity of the data to help protect individuals' health data, to increase patient understanding and control over their data so they can make informed decisions, and finally, to provide guidance and technical assistance on policies and regulations that pertain to the secure exchange of health information. So, what does that all mean? The strategic plan for 2025 will allow for the use of smartphones and wearables to allow patients to access their information while also being able to upload information. It will support accessibility using these devices in rural and underserved populations. The plan will also try to reduce the burden on providers so they can focus more on patients. And it will allow patients to determine the most appropriate care. There will be a consistent vocabulary established for data exchange. An emphasis on research using large data sets will be implemented. And lastly, data exchange and interoperability will be addressed. We have come a long way since the first plan was implemented in 2004, when EHRs, decision support technologies, and other technologies were just becoming popular. It will be interesting to see how the ONC's strategic plan for 2020 through 2025 will be affected by the COVID-19 pandemic. Will the pandemic change the future of healthcare? I'm excited to see what the future will bring for health IT. Thank you.